Hello everyone. We're here with Dr. Gurani today. We're gonna be on live. We're gonna do some question answering everything that you need help. If you have any question about any surgery, if you want to know something about Dr. Gurani, we're gonna be here for you all. Doctor, how are you feeling today?
Good. How are you? You're doing good?
I'm doing good.
I'm going to start by saying hi everyone. Happy 4th of July weekend.
That's right.
This is a great time to spend time with family. We're here for you guys for the next 20-30 minutes. I know it's been a while since we went live, but thank God, knock on wood, we've been very busy. So please go ahead and start
doing your
asking,
questions.
sending us your questions. If we don't get to them, please send them again.
Exactly. So we have, it's not a question, but it's a patient that said, Ali, see you on Tuesday, Dr. Gurani.
Hey there, I'll see you on Tuesday.
Tell us.
Rest up. No, not too much drinking, not too much partying.
No party. Just get ready for it. Let me see. We have another one official to the say Gurani. Another one say the gold. What do you think about it? How you feel when the people say like you're the gold?
I feel a little bit shy. I feel humble. I don't like too much attention, but I appreciate the fact that patients appreciate that I do a good job. It's I'm blessed, and I thank you guys for the recognition.
Yeah. Also, we have a lot of patients saying that you're super good, and I love your results.
Thank you so
honestly,
much. I appreciate it. I mean, you see my work. You come into the OR, you take pictures, and so.
For those who don't know me, I'm the social media videographer, the person who is in the back.
Yeah, but I mean, you do a good job, and I appreciate it. And you're easy to work with. So
thank you.
And she's helping us today so that she can read the questions for me because I can't read them this far away from the phone.
Thank you, Doc. So we have a question here. What is the maximum cc you can get for a BBL?
The state law is 4,000 cc's. 4 liters. If you need help to think about it, just imagine the 2-liter Coke bottle, 2 of those. So it's quite a bit, and that's a safe limit, and I think it's appropriate enough, and there will be more than enough to transfer to the buttocks.
Exactly.
And the hips.
Do you do patients with grave disease?
Grave disease, yes. Grave disease, it has to be controlled. You have to go to your endocrinologist and make sure that it's under control.
Awesome. Can you explain a little bit what is grave disease?
It's a thyroid disease. Where the thyroid is hyperactive.
Oh, okay.
There's medications for that.
Oh, nice. So
it's you always have to go to your specialist and make sure that your specialist has your thyroid hormone under control.
Nice.
Okay, because it could affect your metabolism and your heart rate and stuff like that.
Nice. And it's really good because we care about the patient safety.
Absolutely, patient safety number one.
Mm-hmm.
I'm a stickler about your health. I'm a stickler about getting medical clearances before you travel here. We don't want any surprises. 2 professionals is better than 1. I'm a plastic surgeon. I obviously know my medicine, but not as good as an internist that can dig deep and make sure that you're optimized for surgery.
Yeah. Alrighty.
So yeah.
Okay, we have one question here. Lola say the best, Dr. Granny. I'm so sweet. Thank you, girl. So, what prohibits you from giving some out for a little for a little grafted?
Okay. What prohibits you from giving or transferring 4 liters? Nothing really prohibits me. It's the space. So I can remove 4 liters from your torso, from your underarms, your arms, your chin, inner thighs. But it's the space between the skin and the muscle of the buttocks and the skin and the hips. That's not an endless space. That's a limited space. So I will try to spread the fat as evenly as possible. But there comes a point where the skin will not stretch anymore. So yeah, that's the limit. And also what the patient wants.
Exactly.
And if the patient wants more, then the skin can stretch. Then that's why round 2 is your next option.
Exactly. We have another question here that is really common, but some people, ask, is do you use ultrasound for BBL? Of course.
Yes, I have an ultrasound, handheld ultrasound, the size of the iPhone, for example, and it's attached by Bluetooth to my iPad, which sits right in front of me when I'm working, and the assistant holds the ultrasound to the skin so we can see under the skin while I inject.
And it's really interesting to see.
Yeah,
it's really interesting. I've been learned from Dr. Granny a lot.
Yeah, it's good. It's an extra set of eyes under the skin.
Yeah, so October 2nd can get here fast enough.
October 7th?
2nd.
2nd. All right, well, we're counting down days.
Yeah,
See you soon.
See you soon. July 29th. See you.
Awesome. See you on July and
we have
July.
so many patients coming up. That I'm so glad.
Yeah, I know. We're blessed.
Okay, Clay K say you skipped my question. Can you send it again, please? So I haven't seen it. Okay, I had a breast reduction with Dr. Granny, but need another one. My teeth screw back. His teeth screw back. Like she get a breast reduction, but she's gonna do it again.
Okay. That could happen if we gain weight or during pregnancy. They can enlarge. The breast tissue is made out of tissue that produces milk and also surrounded by fat. So it can happen. Also, gravity doesn't help. It always works against us. So I take it that you're interested in coming back. So you must have been happy with the first result, and I'll be more than happy to take care of you for the second one.
Exactly.
Just let us know. You know my direct message. If you send me your name, I'll send you the contact, or you can give me your contact and I'll send it along to my patient care coordinator.
So can G-plasma reduce the tightness, the bone? Tighten the bone.
Tighten the bone?
Mm-hmm. So, I don't know what she means.
Okay. I'm not sure I understand that question, so if you want to clarify what J-plasma does, so let's talk about this let's try to simplify it as much as possible. So plasma is the fourth state of matter. So you have solid with heat goes to liquid, liquid with heat goes to gas, gas with heat will become plasma. It's like when the lightning strikes and the gas becomes plasma. We take advantage of that. After lipo, we get into the same through the same openings and the same tunnels where I remove fat, and with the J-plasma we heat up the skin and the fibers, the connective fibers under the skin, to get them to remodel and hopefully shrink the skin. How much can we shrink the skin? It is very difficult to give you guys an exact answer, but all I know is if it pushes the dial in the correct direction. So if we have loose skin and on this side we have very tight skin, it's pushing that dial in the right direction. So you're going to get a benefit of the remodeling, and it has to be done in conjunction with the lipo so that we can get the access. And it's it's been around since 2019, and it's proven that it really helps. I'm using it a lot more frequently because now I'm using it a lot more frequently because now I'm starting to see the results after so many years, and it actually works.
No, and I can tell since my surgery I use J-plasma as well, and it's like really worth it. Like I can see my change,
Perfect. And did it take a long time for you to realize that the skin is getting tighter?
Yeah.
It's not
immediate.
It's not immediate.
You're gonna see it like when you're finished results. When you're finished results, you're gonna see it.
2, 3, 4, 5, 6 months down the line.
Exactly.
All right, so
and the more the better, like more time you wait is gonna be better for you. Of course, you need to use your faja, you need to use your foams.
Massages.
Massage is the most important part, doctor. So
how about stretching?
Oh yeah.
Okay.
I remember foams.
Massages.
Massage is the most important part, doctor. So
how about stretching?
Oh yeah.
Okay.
I remember that day that you told me to stretch myself. I was like, damn, it hurts a lot. But no, it's really worth it. It's really, really, really worth it.
It's very simple stretches that you would do after the gym. Reaching up and reaching down to stretch your lower back. But there's nothing better than a patient testimony.
Yeah.
This is liposuction. One event and everything ends after that. No, it's a constellation of things. You have to get ready for it. You have to go through it, and then the massages and the aftercare and all these little things like the faja, the foam, and all that stuff. There's a lot of nuances to it. So it's a very involved. So get ready for it.
And adding for your testimony about the J-plasma, I can tell some people ask me, it hurts most than the liposuction itself. No. It hurts the same thing. Like it doesn't hurt actually. It's the same. It's like
it doesn't add pain.
Exactly. It doesn't add pain.
All right.
You understand? That's
what
like
I
a
noticed
thing.
is also actually decreases some of the bleeding.
Mm-hmm.
That's just my own anecdotal. I don't have exact proof, but I think it reduces the bleeding.
No, yeah, it's really worth it for those who wants to do it. I always recommend it. Of course, you need to know, like, you need to ask your doctor first if you're a good candidate to do it or not. Okay.
And I'll give you my honest opinion.
Yeah.
Thank you.
So I have a question here on TikTok that I read. Okay, hold on. We have to wait for a second round of BBL.
I really recommend that you give yourself at least 7 to 9 months, and it's for a simple reason, so that you can, like we were talking about a few minutes ago, the healing process takes a long time. You're swollen. This is the liposuction of the torso, and if we add other parts, it's a lot of swelling throughout the body, so you will be swollen for a long time. You will start feeling better as every day passes by, a couple of months, and you'll feel like, oh no, I'm ready, I want more. The thing is, under the skin where you don't see, the tissue is still swollen. I don't want to get too technical about the terms and the healing process, but trust me, you're swollen for up to a year. And the reason I can give you this answer confidently is because I have feedback from patients, and everybody's different. The more massages you do, the more you take care of yourself, the more that you're involved with your own two hands, because I always say that you can massage yourself. As you do, the more you take care of yourself, the more that you're involved with your own two hands, because I always say that you can massage yourself.
You told me that, you remember? You told me to massage myself in the shower with the soap and
absolutely,
everything.
with soap and running water, or with vegetable. I'm sorry, coconut oil. I recommend that you get involved with your own two hands, because you don't, unless you have a massage therapist living with you, you can really impact your own care. I'm not saying do it by yourself all the time. You can, mix it with a professional.
One day you use your massage therapist, and then the other one you can do your own massage.
Absolutely, you can reach pretty far back.
So we have another question. Are you doing fat transfer to the breast?
Okay, that's a little touchy topic. For global breast augmentation, no, I'm not. I am using the breast fat transfer to the breast to hide an implant that's obvious. The breast fat transfer to the breast to hide an implant that's obvious. So basically, in selective areas, like if you're looking at your right breast, from the 9 o'clock to the 12 o'clock on the right, from the 9 o'clock to the 3 o'clock, from the 12 o'clock to the 9 o'clock on the left breast. So areas where the implant might be palpable, I will do it, and I will document that so that it does not confuse your radiologist when they read your mammogram. But for global augmentation, I'm not really impressed with it, and I don't want to confuse your radiologist when they start going through screening for breast cancer. So that's where I'm at with that. I have been reading up and following people throughout the country, and there are people that do it, but just remember, it requires multiple sessions of fat grafting, and I think it can be really a pain in the butt, because
it's better to get an implant.
I think an implant is more it's faster, and I think it's safer, because your fat that you put in the breast can show up as scar or calcifications, and it can confuse your radiologist, like I said. And one thing that I've seen is people are starting to use is J plasma to tighten the skin in the breast as well.
And you can do that?
Yes, you can. Yes, you can.
I didn't know you can use J plasma for the breast.
Yeah, it's off-label use, but it's coming around.
But you can perform that with an implant inside, or
no? Well, no. You can, because the implant is not in that area. The implant is below the breast tissue.
Oh, yeah, right.
You can do that. You actually can do that. It's interesting, and I'm looking into it very seriously.
That's super good. That's super good. I didn't know that, actually.
Yeah, no, there's a few people.
The people that needs the tummy, they doesn't need the tummy tuck at all. You can fix it with J plasma. It's the same thing about the boobs.
They're on the border, that they're like right there to cross into a lift, and it might help. I think there's a future for it.
That's super interesting, Doc. So we have another person.
And it might help. I think there's a future for it.
That's super interesting, Doc. So we have another person, Jada Damiani, say Dr. Granite is the best. I just had Lipo 360 with a BBL with him last month. My results are amazing. Everybody keeps asking me where I went. That's really good. I love to get those comments because it's really like, you know, you can tell your own experience with Dr. Granny.
Thank you. And word of mouth is actually my favorite referral because you know it's coming from the heart and it's a personal experience. Patients, I don't really have to do much. The patient,
advertising. The patient
is really being my advocate, my ambassador. Thank you.
Send us pictures. We want to see you.
Yeah.
Send us to Dr. Granny Instagram and we're more than happy to see you. Okay, so what do you use for the stitches?
I use dissolvable stitches. If that's, I hope that answers the question.
Yeah. So another one says August 1st.
See you then.
See you. July 11th with you. 4K CC for my BBL limit is total or on each cheek. If the 4 little CC is just for the completely or it's just one cheek.
No.
If the 4 little CC is just for the completely or it's just one cheek.
No. No, it's since I'm only allowed to remove 4 liters, I can only I have to divide it evenly between the both sides.
It can be 2
and 2, yeah,
2 or less.
Or less.
Exactly, but I think 2 is.
That's more than enough, and like I said, it's not about how much volume you add. I'm sure you guys have heard me say this before. It's about what you take away, where you take it from. It's about sculpting the torso and the body first before you start transferring fat to the buttocks and the hips. It's not about to transfer it and how you stack it.
And also, you are one of those surgeons that see your body first and then it says like, well, let's put this amount. It's gonna be perfect and match with your thighs and with your torso. Like you don't want to do something so big that it doesn't match, you know? So you always watch that first.
You really have to have an eye for harmony. You have to understand
that it doesn't match, you know? So you always watch that first.
You really have to have an eye for harmony. You have to understand every patient is not the same. Some similar. I learned from working with so many people that I can extrapolate from one experience into the other. So from patient A to patient B, I learned a lot of little tricks to predict things. So I've been around for a while, and the volume of patients that I've done has allowed me to create different categories, and based on that, it helps me make an educated decision. But the idea is to understand the golden proportions of the human body, to know what the eye is perceiving as harmony. It's not about transferring fat. Any well-meaning, unexperienced surgeon can transfer fat. It's how and where you transfer it, and how you respect the transitions from one part of your anatomy to the other.
Exactly. That was one of the things that I really love about your job, because it's super like, wow, like, symmetrical, everything matches,
Yeah, you have to make sure that the eye is not distracted by or interrupted in the flow. If that happens, then you're going to perceive beauty. You're going to perceive something attractive.
Exactly. So, do we have to do a consultation for a revision if you did the initial operation?
You always have to do a consultation.
Yeah,
before you do anything, because things change. Even though we might know each other, I would like to see updated pictures. I go and compare them to pictures from before that I've taken. So yes, give me as much information, and this is like any surgical procedure, whether it's cosmetic or anything else, you need a consultation with your doctor so we can get the whole picture, and I can understand what you're seeing as well.
Exactly. We have another patient here, and the TikTok live say try to getting him, but the day wasn't available on day needed. The thing is, we have a lot of patients coming, so of course we prioritize like how
so this is your okay. So it's usually first come first serve. So if you call and you book for a date, then we try to accommodate you. But let me say something. There's a caveat to this. If you're interested in having surgery with me or any other surgeon here that works with me at Icon, just call and ask for that date. And you can also put yourself on a waiting list if you want a specific week or a specific day, because things change, schedule changes, people change their mind, they drop off, they have other priorities. So instead of losing hope, thank God my schedule is consistent and busy, but there's always things that change. So one day I can have 3 cases and things happen, and I can the people drop off the schedule and we can move people around. So if you're really interested in having surgery with me, and I'm grateful, let Annie know that you have some sort of flexibility. That really helps us too, to make to accommodate other patients. Especially if you're dropping off, let us know early so that we can help other patients get on the schedule.
Exactly. So I have one patient here. What's the requirement for Cell Saver?
Okay, everybody is required to get Cell Saver.
And it's better to use it because you feel way better.
Yeah, I think it's not the solution for post-operative anemia, but I think it helps. Like it's your own blood, it's your own plasma. You are going to lose some blood with surgery, with lipo, and I think that in the first 12 hours, I think that volume of red blood cells plus your own plasma, your albumin, helps expand the intravascular volume, draw fluid back into the vasculature, and you will feel a lot better.
Yeah. So will you do a breast augmentation with Lipo 360 and fat transfer only to the hips?
No, I will not do fat transfers. I'm very adamant about this. I will not combine fat transfer with any other procedure. Okay?
Just BBLs or breast with lipo, right?
Now, the breast and lipo, guys, listen to this carefully. First of all, the state rule says 1 liter. When you're combining, I'm not talking about a BBL, I'm talking about lipo with breast, lipo with tummy, lipo with lift. The state Department of Health has a 1 liter rule. I don't think that is very gratifying. 1 liter can help certain body types, but other body types that are larger or have more types that are larger or have more fat under the skin, they will benefit from going above that volume, which is the state limit of 4 when you just do lipo alone. So if you're doing lipo alone, plus or minus a transfer, you will be allowed to go up to 4 liters. So you gotta really listen to my advice and not just be in a hurry to get surgery, get the augmentation, get the tummy tuck, get the lipo, and get the transfer. I think that's very taxing to the body. I'm not interested in doing that. I'm not interested in putting my patient through that. I think it stresses the patient physiology too much, increases the risk of complications, and I'm talking about serious complications. Also, outcomes. So patient safety first, but also surgical outcomes. I want to give you the best outcome possible, so I have to line up all the odds in your favor, and I think the more you combine, the worse the outcomes are going to be. So
you need to be a good candidate to get the procedure combined.
Yes, and also, like I said, the trend that everybody is trying to do breast, tummy, BBL, you're asking for too much stress, and I have seen patients show up to my consultations complaining that they went elsewhere, out of the country or in the country, in the same city here in Miami, and they're not happy with their breast, they're not happy with the tummy tuck, and they're not happy with the BBL or one or the other. So then they end up having to pay more money to get more revisions and more second rounds or redo the breast. So be logical, guys. Be smart about this. Be strategic. It's not just let me get it all done. Things. You spent a lifetime living, and your body went through a lot. Pregnancies, weight gain, weight loss. Just you can't try to just build everything all at once. I know that I'm going to get a lot of pushback from other professionals about this, but I really genuinely don't care. I care about patient safety and my outcomes looking good. So I'm going to stop and get off my soapbox, and let's move on to other questions.
How long should I continue massage for?
As much as you can.
Yeah.
So I don't have a crystal ball.
I get like 40.
You got 40?
Yeah, I get
Wow.
40.
But then remember, she has the advantage of being here in the clinic every single day, and she has Betty, the massage therapist, at her disposal. So I
Yeah.
know it's not fair to compare to you, but Alejandra said something here. It's the number of massages is really crucial, and over a long period of time.
Mm-hmm.
Remember earlier in the conversation we talked about coming in for a second round, and I told you it takes a long time for the swelling to go away, and that's the reason you need to get a lot of massages.
Yeah.
The swelling takes a long time, months and months and months. So
Until a year.
up to
Right?
a year. Has it been a year since your like?
No, 6 months, but I can tell I'm still swelling.
Okay, so
I'm still using my faja, everything.
So
yeah.
this, I've never had lipo. I've only performed lipo. So when a patient says something, I listen too, because every patient teaches me something. So she's been out for 6 months. She's had 40 massages. She's still wearing her faja. She's still wearing her foam, and I'm sure after she learned from me about the stretching and doing her own massages, she's doing them at home. So
Yeah.
Even
still at the shower, I'm like this, like trying to do like my own massage.
good. That makes the result better. The swelling improve faster, and it will smoothen out the skin. Because remember, liposuction it's not like peeling and skin of an onion. You're gonna have some irregularities. So the more you massage yourself early on and you extend the period, you're gonna get much better results.
Exactly,
right?
that's
Okay,
true.
Perfect.
Do you perform ab etching?
Yes. I'm not a very big fan because they look fake, but done in the right along the right anatomical lines, they do look nice. I just think some of the ones that you actually create the six pack look super fake. But
Yeah.
I do high definition lipo in general, and the patients are close to their ideal body weight. They're easier for me to expose their muscular anatomy, and then I take advantage of that, and then we do the etching. But some of that stuff really looks super fake, and I don't think
You
it's
need
attractive.
to be a good candidate.
Yes. Thank you for
to
helping
get
me out. Thank
the
you for
ab
helping.
etching. Yeah. Now everybody can get an ab etching.
Yeah. It's
you know?
easy to do. It's not that hard. But you have to be the right patient. You can't
Exactly.
be that much overweight and then expect. You have to be really fit.
Yeah, and then the same thing that we were talking about the everything matches. You
Yes.
cannot get a ab etching when you have, I don't know.
When you don't have the right distribution.
Exactly.
And if you don't have the right body fat percentage.
Exactly, and that's why we need to see you before your surgery and a consult.
Pictures. We do virtuals. Virtuals are hard to get to because I'm operating, so I have to be in my room while I'm operating, and there's so many hours in the day. But we try our best to get as many virtuals as I possibly can. These these lives, I hope they help. She's gonna post them on my Instagram and on the TikTok for the clinic. So send us questions. I'll try my best. Send us pictures. Nothing is better than pictures.
And how's the best way to reach you? Like
Okay,
to
so
get a message from you.
Gurani MD is my Instagram name. You can DM me. I look at all my DMs. My DMs are only seen by me. I'm the only one that answers, so you're not getting a AI answering you, nor are you getting a receptionist or coordinator. And then I will ask you for your information, and that information is sent to a private secure email, and you will be put in the system, and you will get a call in the next 24 to 48 hours. So that's how it works. So you can easily reach me, and then I can, if you want to talk to somebody in the clinic, I can give you the number, and I can have them call you.
So we have two really good questions.
Go for
the
it.
first one is, what is the best way I can get the hemoglobin up?
Okay, so increase your protein intake, iron, vitamin C, folic acid, B12 complex, B complex. Now, if you have a low hemoglobin, we have to investigate that. So I recommend you go to primary care, and let's see where that anemia is coming from. Is it an iron deficiency anemia? You're not eating the right things, or not to get deeper into the differential diagnosis of anemia, are you bleeding too much on your periods? And so there's different reasons why a person is anemic. Malnutrition could be one. So please if you identify yourself as anemic, if you have a hemoglobin below 12, let's investigate it before you come down, because I want to try to optimize it as much as possible. Because like I said earlier, I'm not so much worried about the patients that get the tummy tucks and the augmentations. I'm worried more about the liposuction patients. I want to get them as close as possible to 12 or cross 12, because it gives us more confidence, because they are going to lose blood.
Even, or we're gonna use the
cell saver for sure. Yeah, the cell saver,
it
but
helps, but
that's not the solution. That's not the solution.
And the second one is, can I be on Manjaro and insulin and still be qualified?
Insulin, yes. Manjaro, no.
Why?
Okay, because Manjaro is it's an effective medication, but just remember what it does. It slows down the movement of your stomach. It slows down peristalsis, so there is more. It takes longer for food to leave your stomach and get into your intestines. Okay, so you are at a higher risk for aspiration if your stomach is full. Okay, that means when you go to sleep, food can get into your lungs, or liquids can get into your lungs. So you have to be off of it at least 7 to 10 days. Off of Manjaro.
But it's not that much.
No,
and then when she can return for Manjaro?
After the first couple of weeks, I think you can go returning to Manjaro. You want to eat after surgery. I don't want you to eat the wrong things, but you have to eat. So high protein diet and high protein meals, so you can heal, because you need the protein to heal. So I would wait at least a couple of weeks until you're over the very hypermetabolic period of time.
Of course.
Manjaro is effective. I have no problem with it, but if everybody knows now that it's a weekly injection. So think about it. It takes a week for the effect to go away. So you need to give me a week before surgery.
Okay, perfect. So what BMI do I need to get a BBL?
Okay, the rule is it has to be below 40.
Yeah.
I don't like BMIs. You guys know that about me. I don't like the BMI number, because it doesn't take into account your body composition of fat, bone, or let's say fat and lean body mass, which is muscle, water, and bone. But sorry guys, it has to be below 40. So send me pictures and send me your real height and your real weight, and we'll help you if you don't know how to calculate it.
Okay, do you have any advice for people who have history of keloids?
Yeah, so whenever you have an incision, if you're a keloider, if you're somebody that has these very thick scars that look like they're mushrooming out of the incision, there's a high likelihood that you're going to get them, especially in areas of high mushrooming out of the incision. There's a high likelihood that you're going to get them, especially in areas of high tension, or on the chest, or even on the abdomen. So what we do is you just heal from the first procedure, and you can have that scar removed surgically, or injected with steroids over multiple months, and that usually improves it.
Okay. So does a Lipo 360 make a difference on an obese patient? Is it worth it?
It's worth it? Well, okay, that's a very loaded question.
Yeah.
Okay, is it worth it? What's more? Let's start by
that Lipo is not a weight loss surgery.
So I'm still a physician. Being an MD, I have to let you know that that's not a solution to lose weight. Okay, if you've been designated obese by your physician, your primary care physician, you need to get a consultation with your primary care physician to see how you can lose weight. I don't want to sit here and tell people how to lose weight. I'm not a nutritionist and I'm not a weight loss physician. Obviously, removing fat from under the skin will help give you shape, remove volume, because we're actually vacuuming out, sucking out fat cells.
And it's gonna make you
it's gonna give you shape. It's gonna give you shape. Is it gonna make you healthier? No.
No. It's gonna lower your weight?
It's gonna lower your weight, yeah. I mean.
But significantly?
Well, roughly 1 liter equals 1 kilo. So 1 liter is 2.2 pounds.
So 4 kilos?
About 4 kilos. So let's say times 2.2. So about a little bit around 7 pounds you lose with the lipo. Now, if I put some of that fat, there's a net difference there.
You need to know your math.
Yeah, but so if you're considered obese, yes, we can remove fat cells. Fat cells don't come back, but fat cells can grow in other parts of your body. So a lot of patients will come in a year later, say, I've gained weight, doc, but it goes inside or went to my arms, or now I've gotten a few patients, my thighs are bigger, or the fat transfer got very big. And I'm seeing a lot of that. Well, just remember that fat that I removed from you. And I'm seeing a lot of that. Well, just remember that fat that I removed from your torso and placed into your fat can easily grow.
So what happens if I'm a patient that get a BBL and I gain weight and I would love to get a little bit reduce my butt? Can you perform that surgery?
Yes, and you've been in the OR a couple of times, so that's a good question.
Yeah.
Because we've had more than a handful of patients now come in asking for buttocks reduction.
Especially last week, we had a lot.
We had 2 of them. You're right. So I've been combining Lipo, because I mean, if you have an eye for symmetry and you understand where to go for Lipo, you can sculpt them down. You can reduce the volume. I worry about the skin, so skin is unpredictable. So I've been recommending the use of J-plasma.
Exactly.
So I'm combining Lipo of the buttocks. You can do Lipo 360 as well, but I'm saying we're just talking about the isolated case where we reduce the buttocks alone if you want to. And I'm recommending J-plasma very, very highly because it does help shrink the skin.
Mm-hmm. So can I still fix my belly loose skin after 2 years of Lipo?
Yes. If you are happy with your shape and the skin hasn't retracted enough and it's not as tight or flat as you want, or you have a fold, let us know. Send pictures, and maybe it's time for your tummy tuck. I tell patients always, give it your best shot. Do your massages, wear your garment, and then if you're happy with your skin, some patients don't want to have that scar down there, but those scars can be very inconspicuous. We can hide them under your underwear, bikini line. So, hey, let me know. Send me your information on the DM, and we'll start the process rolling.
Exactly. So I can see here a lot of people say, how long does the J-plasma last?
How long?
We say, I'm sorry. I think we say like a year, like completely the entire process, right?
But they're saying how long does it last in terms of like, does it expire? Does it go back? I don't think we can think about it that way. I think once you get remodeling of the tissue and the fibers under the skin, I don't think that effect goes away unless you gain weight again.
Mm-hmm.
You know what I'm saying?
Yeah.
So it doesn't expire. It's not that. That's not the right way to think about it. We get in there after the lipo. I do my passes with the rod, the J-plasma device, and that heat will help the skin remodel. Obviously, if we age, gain weight, the skin's gonna respond to that. But it doesn't expire. Like if you maintain yourself, you take care of yourself, you do your massages, you moisturize your skin.
And I think one of the most important part as well, after your surgery, after everything, you're completely healed, I think it's really important to do your diet. You don't have to do like a strict diet, like just lettuce and chicken, but you can do, not going to McDonald's every day, not going to Chick-fil-A every day.
So you need to know how to eat.
Exactly.
You need to know how to, you need to learn what a proper diet is. And again, we're not here to tell you guys exactly how to eat. That I'll leave that for other professionals, weight loss doctors and nutritionists. But you need to know your food groups. You need to know your macros. You need to learn how to understand what your insulin does to you. Insulin makes you gain weight, and then you become insulin resistant. And there's a lot of foods out there that are taunted as healthy, and they spike your insulin. So it's interesting. But more and more as these basic science researchers are coming out with more and more information about how insulin makes us gain weight. So it's important for you to understand.
And if you want to know more about it, you can always reach.
Makes us gain weight. So it's important for you to understand.
And if you want to know more about it, you can always reach a nutritionist.
Yeah, absolutely. Or the easiest thing to do is go to YouTube. There's a lot of credible people on YouTube that
do your own research.
Do your own research, and they explain to you about the effects of the foods that we're eating.
Exactly. And we have one question here that say, can I have a baby after a tummy tuck? I don't really want to, but just in case.
Okay. Having a baby is a blessing, and I never tell you not to. Will your skin stretch? Yes. Would you need a revision? Maybe. Have I seen individuals? I've seen patients of mine.
Ready. We're back.
I've seen patients of mine get pregnant and come back and get redo their tummy tuck. I have seen patients do very well. They have good skin. They don't gain too much weight. They have a good pregnancy, and that's it. Yeah. So never let the tummy tuck prevent you from having a baby.
Okay, Miss PLM saying hello. Can Dr. Granny answer my question regarding fibrosis, please? Can you send it again? Probably I just skip it. I don't know. But
fibrosis.
Yeah, she says she asked something about fibrosis.
Okay, please send it again.
Yeah,
we'll
send
keep
it
an
again.
eye. We get involved with the conversation, and we missed some of the questions. We would love to answer them for you.
Yeah, let me see if we have any question here on TikTok. I'm checking my TikTok people that is connected here. Give me 1 second. Okay, now, doctor, give me one advice after my BBL I can use or anything that can help to my recovery.
Immediate recovery or long term?
No, immediately, like after my surgery, day 1 post-op.
Okay, so you're gonna make sure you have a protein dense, high protein diet. I want you to walk. I want you to hydrate.
Is it enough if I take just a protein shake?
No, solid food. I really don't like people drinking their calories. I think drinking your calories, unless you really have to, I'd rather you eat. Okay, you can. I know there's a lot of protein shakes, but they can be very high calorie, and that's not what I want you to do. I want you to eat a lot of high protein. I want you to hydrate well, ambulate, walk, very often. Get out of, after the first post-op visit, you can take as many showers as you want. You can massage yourself as much as you want. So, massages. It's like ties back to everything we've said before. If people have been watching, it's great to have a patient that's sitting next to me talking about it, because they know better than I do how they feel. Yeah.
And also the other day we were talking about a stage 2 faja.
I don't like them.
Yeah, I would like
them.
to get to that point. Why you don't like it?
Because they're too stiff. They can cause deformities. They can mark you. They can fold in the front. Because look, I'm sitting right now and I'm folding my skin, and my t-shirt makes lines. And when your skin gets lipo in the first 6 months of lipo, after lipo, you can easily mark yourself. And those fajas are not forgiving. They're not forgiving. I don't like them. I just don't. I think people overdo it with the fajas. I think a faja that maybe you take it in or you tailor it with foam is more ideal. But again, I don't wear fajas myself, so I have to ask you, what did you feel about the?
I think it's really worth it, but after you use your stage 1
yeah.
until
How many
it
months did you
gets.
wait?
Wow, for it changing
To go to a second stage.
1 month.
1 month.
Yeah.
So you heard it from the expert herself. She's her own.
But you will know. Every person is different.
But you gotta be careful, right? Because
you need to be careful and always ask your masseuse lady what she thinks.
The massage ladies, my assistant that has had lipo as well, Laura, could give you advice. I really think that overly tight, overly stiff garments can mark you.
Yeah.
Can push swelling into your armpit area.
And also you can keep your liquid inside the fluid.
Yes.
It can just make a line and it's inside.
Yeah, and I think that I think you have to be careful.
Yeah. So the question of EM is PLM said, I had Lipo 360 with Dr. Granny. I know I had fibrosis. Is there something I can do for it besides getting more surgery? Like, besides to the more surgery, yeah.
Massaging. Try to really get in there with the massages. This is how depends. Is it causing any restrictions? Do you have scar bands, or is it just tight skin? You need to, honestly, massages. I cannot emphasize, and you might want to have to go to a professional where they use these metal instruments where they can really get in there and try to break it. She had some fibrosis, and with just stretching alone, she was able to get rid of it.
Yeah, and also you told me the other day to start doing my massage, my own massage, and it helps.
Yeah.
Like until I barely see, but I feel better actually. So we have another question here that say, do you do fat transfer to tuberose breast?
Oh, the tubers. No. I like, remember earlier in the conversation, I said I don't do global breast fat transfer, and the tuberous breast deformity is more a surgical procedure, not fat transfer. You have a herniation of breast tissue through the areola. The areola is very dilated. The base is very high and narrow, so it needs surgical intervention. And it might be, depending how severe the tuberous breast is, you might need 2 stages. So it's when the breast is, the fold is very, very high, and the breast is narrow, and the areola is big, and the breast tissue goes out through the areola. So it's a condition where it is really a surgical intervention that's more warranted for that, and there are different degrees. So please send pictures and I'll give you advice.
Exactly. Okay, we have another question that say, yo tengo mi cita programada con él en noviembre.
All right, bienvenido. Estoy esperando.
El doctor habla mucho español.
Poquito.
No, un poquito no, doctor. Diga la
Suficiente.
verdad. Diga la verdad.
Estoy
Él me entiende
diciendo.
completamente todo. Okay. How about getting back into a faja? It's been 3 years.
After fibrosis?
No. Getting back into a faja after 3 years of postdoc. I always recommend to wear your faja, you know?
We have, I've heard from patients stories that they sometimes sleep, not every night, but they feel more comfortable getting the faja. And I think the faja does help with fibrosis. It does help with swelling, but I don't think that's the only answer.
Exactly.
And in Miami heat, forget it. I don't want to have a faja on me. But anyway.
We have another patient that has said, I had a BBL with Dr. Granny in January, but I want more projection. How long should I wait for my second round?
I think you should wait at least 9 months so that the swelling on your torso has improved. And then we might actually have to go for inner thighs or arms or upper back. We have to look for more fat, and we can do the second round and focus more on your projection. Let me touch on that for a second. Remember we talked about earlier how much fat can we transfer? Okay, and I said it's not an infinite amount. It all depends on the space and the elasticity of the skin. And some patients, it doesn't matter how hard I try, that's an area that's in the middle that causes the projection, or that helps me create the projection, can be very tight and very flat. So it doesn't matter how much I dump in there, it's not gonna, grow beyond a certain point. So every patient needs to know that you might have a home run from the beginning, but keep an open mind that you might have to come back for a second round, and it's not because the first round failed. My goal going in there is to give you the best result possible from one procedure, but the skin doesn't always give me what I want.
Yeah. Sometimes you recommend to the second. Even before the first surgery. You heard
me say that.
Yeah.
There are some patients I know right away that they're gonna need a second round, based on what they're saying and what I've seen in my experience. So just keep an open mind, and if you're not happy with your projection or you want more, please come back. Let me know and we'll do it again.
So we have the MCPLM say, what stage should I wear then?
Because of the fibrosis?
Yeah. The first or the second?
I think at this point, if you've been more than 3 months, I think go for it. Wear a second stage. Just make sure that it doesn't mark you too hard and cause deformity. But I mean, you're probably already healed enough that you should be able to go for the second stage. But don't focus so much on the faja as much as focus on stretching and massaging your skin. The physical therapists they have these metal blunt instruments that you can purchase online, and you can use lotion or oil, and you can, because the hand can sometimes hurt or it's not strong enough, and you can massage those areas. You can stretch and massage the areas where you feel the fibrosis. Always massage towards the groin or massage towards the armpit. That's where the lymph nodes are. So that should help.
So how long we'll have to sit on BBL pillow after surgery? Any advice you want to give out of town patients?
Okay, so do not sit the way I'm sitting on my buttocks after a BBL, because you're going to put stress on that newly transferred fat that's trying to integrate. You want to sit on the lower thigh right above your knee. You put the booty pillow right there, and then you need to buy a pillow for your lower back. So get a nice thick pillow, so that between the pillow under your thighs and the pillow behind your back, your butt is not putting your pelvis is not putting too much pressure on your skin and causing flat spots or causing the fat to not make it.
And when you recommend to start using the BBL pillow, because I know
You
some
can use it
doctors right away.
I mean,
some
listen,
doctors likes to wait like at least 2 weeks, but I would like to know your opinion.
Look, a human being has to go to the bathroom. A human being has to get transportation.
Of course.
I don't want you to sit on your butt
For how long?
for 4 weeks.
Okay.
I don't want I'm strict about the 4 weeks, not less than 4 weeks, but for short periods of time, like for takeoff and landing in a plane, for transportation, you have to be safe. There's no way you're not going to be able to sit. So try to put the booty pillow in the car, right here behind your knee, above your knee, and a pillow behind your back, and see how much you can do to avoid putting pressure on your buttocks.
Exactly.
But we gotta continue living.
Of course. Of course.
So
we need to sit.
we need to sit
It's
a little
important.
bit, but we can't sit like us and have a conversation
Exactly.
for I don't know how long we've been on here, but it doesn't matter.
It's been
a while.
It's been a while.
But again, just try to minimize the amount of sitting. You do have people drive you, so you're not putting that much pressure on your buttocks while you're driving.
Exactly. So we have another question here. She said, I have a question. I will have surgery in November with you, but I'm afraid of any reaction.
Oh, that's a very general comment. Look, let's break it down this way, so maybe your anxiety will improve if I say the following. We will ask you for your information, your health history, your pictures. I'm going to review all that with I review everything. Nobody reviews my patients for me. We're going to send you to, and then I will deem you an appropriate candidate. Then you're going to go to your PCP and get evaluated, and if there's things that we missed or things that you didn't let us know about or things that you discover, that information is coming to me. I review your labs, I review your medical history, I look at that history and physical closely. If there is evaluations or consultations that we have to do with other specialists, we will do that. I'm board certified. I have a lot of experience. We're in a state certified outpatient clinic, outpatient operating room. Certified outpatient clinic, outpatient operating room. I use a CRNA or an anesthesiologist. They have a good track record. They're board certified. So, and then we've been talking for a while now about all the different. And then we've been talking for a while now about all the different
situations,
details about the recovery. So I hope.
I'm gonna talk about my experience. It's not a secret that I'm an excited person, and I get panic attacks. And I can tell in my surgery I was super calm. Of course I know the stuff, but I think one trick is know your doctor first. Get your consultation as soon as you do your pre-op. I think you're gonna feel way better. Like you're gonna feel like you already know the person who is gonna get your surgery for you, and it's confidence. Like you feel like I know you. I feel like I think that's one of my recommendations. Like
that helps.
That helps me a lot.
Yeah, I mean, a lot of patients have anxiety. That's why coming, obviously you have to come see me the day before. If you can come down earlier and have an in-person consultation and you can afford to do that, come down to Miami. We're available to do that. If you contact the staff, they'll try to put you on the schedule for an in-person consultation. There's a little bit of waiting because it's a little bit, if you contact the staff, they'll try to put you on the schedule for an in-person consultation. There's a little bit of waiting because it's a little bit, surgery is unpredictable. Have some patience, create a good book. But like Alejandro's saying, anxiety is normal. This is a surgical procedure. This is not a walk in the park. This is serious. So we take it seriously. You can rest assured we take it very serious. Your health and your safety is the most important thing, right before your outcome, which is also important. But we try to line up all the odds in our favor and in your favor so that we can have a successful procedure and cruise through it in a healthy way. So I hope that helps. Make sure you let us know about everything, your health history, your medications, anything that you take that's not been prescribed to you by a doctor, things that you prescribe to yourself, family members that have had anything you can tell us about your history, health history. And my anesthesiologist experience, we can prevent. I'm happy to hear, because then we can, based on our experience and my anesthesiologist experience, we can prevent things from happening. We can do investigation, or we can do a procedure and tweak things in your favor. Okay?
Exactly.
I think that should help.
Yeah. So we have another question. Do you recommend getting a BBL and breast implants all in once? I think we already talked about it.
No.
But we can.
No.
We say that again. Dr. Gurani doesn't like it.
I don't like combining a BBL with anything else. BBL is enough of a procedure by itself, and then you want to put breast implants and get a BBL. So,
like, can I get a BBL without Lipo 360? No.
So what is a BBL? The word BBL is a Brazilian butt lift. So it's a generic. It's a colloquial term. It's not really a medical term. A fat so it's lipo of the torso and any other part that we discuss, and transfer of fat into the buttocks and the hip. That's what a BBL is. So it's a fat transfer to the buttocks. So it has to include lipo. I don't like combining a Lipo 360 fat transfer to the buttocks with a breast or any other procedure. Okay? Can I combine a breast with Lipo 360 alone if you're the right candidate and you don't have a lot of fat to be removed?
Exactly.
So that should, hopefully that answers your question.
Are you allowed to get chin lipo the same time as a BBL?
Yes.
Is that a procedure, combined procedure?
Yes, it's a combined procedure. No, that's lipo. Like I said earlier, if you're just doing lipo and then a transfer, you're allowed to combine. It's the fat transfer combined with a breast, or the fat transfer combined with something else. I guess we're confusing patients. I don't know. I'm sorry. But liposuction in itself with fat transfer to the buttocks is okay. So if you want to add your chin, your arms, your inner thighs, that's very common.
Exactly. Lipo everywhere.
Lipo everywhere.
With a BBL,
with a BBL
it's fine.
Lipo BBL with breast, not fine.
Not fine. Okay.
I know other people do it. So if that's what you want and you're
rushing to get
you're set on it, please. I'm not the only one in town, and this is just my preference.
So we have another one. Is G-Plasma recommend for Lipo 360 on obese patients? On obese patient. Obese.
Oh, okay.
Sorry. My English.
No, it's okay. Look, I like G-Plasma. I cannot tell you exactly how far it's going to tighten your skin. It's going to push the dial in the right direction. It's going to help. I have to see you. I have to examine you to give you my best honest advice. I have told patients not to even bother, that their skin is far damaged and they're going to have lipo and the tummy tuck after that, or tummy tuck first, then the lipo. So just give me the opportunity to examine you. And sometimes it's really hard online. It has to be
just with a few words.
So just give me the opportunity to examine you. And sometimes it's really hard online. It has to be
just with a few words.
With a few, no, not only with a few words, but also a few pictures.
Exactly.
Sometimes, you can go ahead and put it on your, add it to your procedure, and we can remove it here if you want to. So that you know how much it's going to cost you. And if I don't think that it's going to help you, I will honestly tell you, don't do it, and save your money for a tummy tuck.
Yeah. Do you offer ab etching? I think
yes,
we already
I do.
say yes.
Yes, I do. For the right patient, somebody that's close to their ideal body weight, that they're in good shape, then etching makes sense.
But not the 4-pack, 6-pack, 8-pack.
6-pack, 8-pack. You know, I mean, it's kind of they look fake. But a person that's fit and you help them remove that stubborn fat at the very last amount that they cannot clean with they can't get rid of with exercise, then that makes sense. But you know, if you're really overweight, then ab etching is just a joke.
Yeah. So I had Lipo 360 in May 14 and I look great. Thank you so much. Definitely will recommend.
Thank you. Send us pictures, update us. I'd like to see.
Yeah.
You guys leave very quickly and we don't get to see the results except online. So please update me so I can, you know, enjoy the success.
Are your appointments far out?
Again, knock on wood. Thank you so much. I am very happy to say that, you know, I'm blessed. We have consistent number of cases coming through. I don't do a lot during the day. I don't go more than 3 to 4 cases. So my schedule is booked all the way out to the end of the year. But I said that earlier. If you weren't on the live, send in your preferred day. Maybe choose more than a couple of days. Give us a range of dates that you like. I will try to accommodate you because patients tend to drop off the schedule, and we can put you on a wait list and give you their spots. Things happen for one reason or the other, and patients have to reschedule. So there's always, you know, just because I have a busy schedule doesn't mean that you know, we can't fit you into a spot. Somebody else might drop off. So send in your consultation inquiry. We'll start a medical record for you. Everything is encrypted. Everything is safe. I will review you and see if you're a good candidate. And then, if your heart is set on one specific week, we'll try to work with you as much as possible.
Try to make it for you.
Yeah, my pre-op coordinator is very good about. She's in a different office. She's not distracted by anybody else. All she has is her computer and her phone, and she's always trying to juggle cases around.
Okay, so I come on the 3rd for my breast. I can't wait. What's the recovery time for them to drop?
It takes about a month to 3 months to see a complete, you know, the skin. When the skin goes on tension, what's going on? When the skin goes on tension, because of the new implants, the skin starts remodeling, and it will have, they will feel high and tight at the beginning, but they will drop a little bit. So a month, about 3 months. Most patients say in a month.
Right. Okay, I think that's it, Doug.
Okay.
That's it. We don't have any more questions. If you have any other question, you always can comment on this video. We're gonna post it on Dr. Granny's Instagram. We also have the TikTok live on. For those who are watching the TikTok live, you know, you can always send us a message or leave your comments or whatever. Well, we have another one really quick.
Okay.
Do you offer fat transfer to the breast? We already talked about it, but
Okay, so in very small amounts, so not to replace an augmentation, but to hide an implant. So like in the middle here, if somebody can palpate their implant, if they feel it, that I can do. But I don't like doing fat transfer as an augmentation to the breast, because I think it can hide or prevent the radiologist from early breast cancer detection. That's my opinion, obviously. I've heard it from multiple specialists, radiologists that say that the scarring and some of the calcifications that might happen after the fat transfer can give them a hard time figuring out if something is a cancer or not. So that's why I don't.
So let's do the final question,
Okay.
the last question,
Do
so
it.
you can go home and rest and
Thank you.
enjoy your 4th of July. So what's the wait time between a BBL and breast lift? This is a really good question.
Okay, that's a good question actually. I tell patients that in 3 months, I feel comfortable putting you back on the table and doing another procedure. So, and I'm not talking about doing another BBL. I'm talking about you get a BBL or a Lipo today, 3 months, then you can come back for the breast. If you had a BBL and you want to come back for a mommy makeover, then I really want you to wait at least 7 months. where the swelling has improved. Because the breast is not a problem. I can do that in 3 months, but the tummy tuck area where I did the lipo is going to be swollen, and it's a lot harder to operate in that very swollen, kind of hostile territory until we're past about the 6-7 month period, and especially you know, with you cooperating and massaging yourself to feel better about operating on the tummy tuck. Okay, listen, thank you so much.
Thank you,
that was
Doug.
It was
great, super
I
nice. This is my first live with you.
You did a good job.
Oh, you did a good job, doctor.
You're easy to talk to, so, and you know what? I appreciate the fact that you put your input about your own experience.
Yeah.
It's a private, it's very private to have surgery, but I think the patients out there will appreciate it.
They're always asking,
yes.
You know, they're always
you're very kind, and you're also very easy to talk to, and I think I've seen you in the hallway. You talk to patients, you give them your experience, and like I said, I can do it, but I've never felt it.
I'm your person, Doug. I'm the person that felt it. I'm gonna say my
please,
experience.
Let us know. Thank you so much.
Thank you, Doug. Thank you, guys. You can always leave your comments, okay? Happy 4th of July.